believe we're live. I'm just waiting for there it is. Welcome. Good morning. Good morning. Good morning. It is Wednesday, the 9th of the 3rd, which means that it's Physio Wednesday. How exciting.
Yay.
In case we haven't met, my name's Yanni Baumeister. Below me is Richard Lellies. We are the head coaches from Unity Gym and the Unified Movement System. And across from me is Phil White from ADPT Physio. And today we are going to chew on a really, really great question and topic that came from one of our new tribe members who is actually currently doing our 5-day flexibility challenge with RAD. And she wanted to know how her injuries, of course, the phone rings right now, how her injuries are going to either prevent, restrict, or interfere with her ability to participate in the UMS program. It is a great question, and I really wanted to hold back on this one until we had Phil on the show. My response to her, I'll read out the question, and then I'll read my response, and then we're going to get Phil and Richie to dive in. But before we do this, if you are watching on YouTube, please, please, please smash that like button. I'm going to do it right now, and I hope everyone else follows me and does it too. And introduce yourself. Let us know who you are, where you're tuning in from, and we'll send you some love. I can see we've got a few people on the live in the UMS Mover Mastermind group, which is where this is streaming as well. If you haven't already, jump over and join the UMS Movement Mastermind Facebook group. We've got Dave Clark, Vinny Brown, a couple of our OGs in there. And that's where you get access to our free training, flexibility routine, our warm-up routine, and you can join our 5-day flexibility challenge with RAD. So do get over there. Okay. How are you guys?
Right.
Very well.
Very
And
well. I
all
can
the
see
water
your,
that's
I can see,
continuing to flow.
yeah, that's right. Everything's flooding in Sydney. I can see that Phil's tuning in from his clinic in the old
Yeah.
Unity Gym, formerly known Unity Gym in North Sydney. How is it flooding there? Is it flooding in the gym at all?
Yeah. No, the gym seemed to be mostly okay. I live in Manly, where a dam overflowed, and luckily I live a bit up a hill, so everything was all good. So yeah,
Awesome.
hope that's the end of it.
Awesome. We've got Steve Cavanagh from Kellyville here in New South Wales as well on the YouTube channel. Awesome to see you again, Steve.
Yeah,
Now,
so good to hear your name.
yeah, absolutely. It's been a while since I've seen you join us live. So, our legendary tribe member in the 5-day flexibility challenge has asked, uh, what? How does early onset arthritis in the knee affect training? She has had a bilateral knee arthroscopy and on both knees, and between doctors' recommendations and some chronic pain, more on the left side. What are our thoughts on the deep squat specifically? There's a lot of, she says, there's a lot of misinformation, and I feel that sometimes if we push past the initial pain, then programs such as ours, the UMS, will literally feel like a new lease on life. But anything extra, I should be a little more cautious of due to the mechanical knee condition. And I responded saying, depending on the health of the cartilage in the knee, there's situations that warrant reduced knee flexion, including deep squat. This is where we would recommend that you consult with your physical therapist or physiotherapist if you're in Australia, or our legendary Phil White from ADPT Physio. Now, I come from a place of a little bit of skin in the game with knees because I had a pretty severe soccer injury in 2013 and had a knee dislocation, had a full knee reconstruction, and had quite a lot of damage done. And so the knee is something that I've sort of had to think about a little bit with my training. It hasn't, of course, other than the sort of 10 to 12 months of rehabilitation and getting back to sort of things like running, so far, so good with squatting and deadlifting and things like that. But it has been a process of navigating it. And I have made the choice to not let it interfere with my training much at all. But I still have to listen to it. For a period of time, I had a giant Baker's cyst in the knee, which is like a swelling, a fluid buildup in the back of the knee that Phil might be able to fill us in on a little bit more if we have time. But yeah, I didn't really want to go much deeper than that until we had Phil on the show, which we do today. So let's get the professionals' opinion. And I just want to leave on, before we cross to Phil, the importance. We did a show that was really, really good previously on the importance of getting the right people in your corner on your team. And the right people doesn't necessarily just mean a physical therapist or a physiotherapist or a medical doctor. I really like to encourage people to get professionals in the right field who also have some skin in the game with exercise, or if you can't find someone who trains a lot themselves, find someone who is a specialist with athletes, because then they're going to understand how important exercise is to you, and they're going to understand, they're going to have a better idea of understanding and conceptualizing what your goals are and what the best possible outcome is for you through the practice. So Phil, let's dive over.
Yeah, so this is a really good question. It's such a big question, and it's going to be hard to go into all of the factors in just this short amount of time we have together. And also, we'll just get the disclaimer of having not worked personally with Sharina and knowing the full context. This is going to be not specific advice, but a way to think about arthritis and kind of how to approach training when you've got a history of injuries. Basically, the thing that I really want you to take away is that the body works in systems, and when you have a change to the cartilage within your knee, that doesn't mean now the knee is not going to be tolerant to any type of loading. So there's muscles and ligaments and a whole bunch of other structures around your knee that are basically providing support. And if we can strengthen up the muscles, particularly around the knee, and also the muscles of your hip and your ankle, then that's going to really deload the amount of load that goes through the cartilage of your knee. Now, that deloading can mean that then it's a bit more comfortable. But the other big thing I want to talk about is, and we've talked about pain and pain science quite a lot on the different shows over the years, but it's really important to understand, just because you do have this change to the cartilage, that doesn't necessarily mean that that's going to be causing a certain amount of pain when you do movement. So I'm sure you'll notice that, some days you'll do things and it feels really good, other days it'll feel really bad. There hasn't been some massive structural change between those days. It's just there's so many other factors that are impact what actual discomfort and pain you'll feel. So the key takeaway there with the pain science side of things, it's probably something that's worth looking into if you have got this kind of background and you are aware of sort of you mentioned chronic pain in your post there, is really getting your head around pain science. Maybe we can link to some resources there or past episodes where you can hear a bit more about it, because knowing what is useful pain to listen to and what is maybe not so useful pain is a really important skill when taking on your training journey. Now, in terms of deep squats specifically, I just want everyone to realize that it's really common that people will sort of just completely cut themselves off from doing a specific exercise. That might be a squat, that might be a deadlift, a bench press, whatever. And they'll think oh, I can't do squats. But you've got to remember that there are so many different variables that you can change within a squat to change the way it loads through your body. And you can, and it's all on a sliding scale as well. So a lot of people kind of get the idea that, if you're not squatting ass to grass, then it's not a real squat. But there's no reason why you can't start by working in a much lower range and then gradually moving towards that full range. And if you don't ever get there, then if every time you go to that end range squat, not to say that will be a problem, but as you get closer and closer, if that's not feeling good, then it doesn't mean that what you have done before is not worthwhile. I think people kind of get a bit binary about this, whether it's either I can do it 100% or I can't do it all. But really, you've got to remember that there are so many different variables that you can work with. So that's going to be how much intensity, so weight you have either in your hands or on the bar, the volume you're doing, the range of motion, the speed at which you're doing the movement as well, so controlling the eccentric versus dropping straight into the hole, and also the complexity, so which of the different styles of squats you're doing. So there's all these different levers that you can pull and all these different variables that you can change. That means you can get, pretty much all of the benefits of squatting without just getting into the aggravating part of the lift. So yeah, I think definitely there's going to be a difference as well between mobility, like you're in the flexibility challenge group at the moment, which is going to be quite a different approach to training than when you're going in like to a squat than a squat that's designed for building strength. So you got to remember that there's going to be a difference as well of whether or not you are putting on extra weight versus doing a regular mobility squat. So
one of the key messages. Sorry to jump in and cut you off. One of the key messages in the flexibility 5-day flexibility challenge, and I don't want to give too much away here, but it is to give people a breakthrough to understand that flexibility is about developing strength through range, and the range of movement is one of the main variables that need to be progressively overloaded, and progressive being the key word there. So you might be starting at a very different range of motion, range of movement than someone else, and that's fine. And I'd like to reinforce here that, there are so many different benefits to exercise that we don't usually consider. And seldom do I see a better benefit from exercise than watching someone's emotional and psychological health improve as their strength improves. The two tend to go in correlation, and when I say strength, I look at strength as a skill that encompasses range of motion, mobility, flexibility, all of that, skill in different movement practices, whether it's to master a squat or a handstand or a deadlift. I look at all of that as an improvement in strength, and I would say to anyone that's in this sort of position where they're thinking about, should I join this program? Is it going to make my injury or issue or pain better or worse? It's about the fact that you're going to have exposure to a team of professionals who are going to nurture and guide you along this path. Your path may look slightly different to someone else's who has no injuries or issues, but it doesn't matter. It's not about that. It's not about replicating what someone else is doing. It's about you improving yourself, and the emotional and psychological benefit to yourself making progress forward in physical strength and capability. You cannot even begin to appreciate what that does for you in every other facet of your life. So for anyone in this position to echo what Phil's saying about the fact that there is so many different variations of a squat that you can do, I'm going to go one step further and just say that it's absolutely essential for people to train. And this is why I would recommend that you do a program like ours, or work with Phil, or just work with a professional, because you're not going to be making, there's going to be a lot less room for you to make mistakes and get it wrong, if any at all.
Yeah, and I think the biggest thing to take away from this is the worst thing you could do, worse than deep squatting and hurting yourself deep squatting, is doing nothing at all, because it's just so known that the best thing you can do for exercise, for arthritis particularly, is get a really good exercise practice that can keep the strength of the muscles around your joint. It helps keep the bone mineral density really good. It gives stimulus to the cartilage to do any amount of healing that it can do, and kind of almost as equally important as that, although it might not seem as people get very structural, is that, and having a positive association to exercise, it changes the way that you consider your knee. If you think of it as always being a weak point of your life and something that stops you from doing what you love, if you can follow a program that gradually onboards you to being just that much more strong, capable, yourself, how you felt pre having all these issues, then that's going to have a massive effect on how much this past knee injury impacts your current life. And that's going to be great for pain. Also, a big thing with knee arthritis is weight management. So having an exercise practice and a nutrition practice that helps you maintain your weight, because with the knees being a weight-bearing joint, it has a huge impact, and it's like it will have a direct impact on your pain as well. So I know that's not necessarily directly related to whether or not you deep squat, but what I really want to encourage is that you like use this motivation that you have right now to get on top of things, to start this habit of health, nutrition, and positive association with your body, because it can be so hard after surgeries to where you just feel like you have such a negative association with your needs after that. So that'd be my big encouragement is, whatever the case, like don't let the fact that if it goes to, like if you try and work with all those variables and you still can't get a perfect deep squat, that does not matter. Keep exercising, follow the rest of the program, and focus on building up that habit.
Yeah, well said. Well said. And I'd like to just open the floor for Richie to finish the show and put the icing on the cake, awesome sprinkles on top of the icing, with his 2 cents.
Hey, I think the biggest take home is don't stop training, really. I mean, whatever the injury is, I mean, I'm sure there's plenty of examples when you shouldn't train, but for a lot of the injuries that we discuss on the show, like tendinopathy and arthritis, like you can't stop training. It's so important to exercise, keep the body healthy, and yeah, it's like it's good to know. It's great to know. I think there's a lot of people out there that don't know this, and I think that this is valuable stuff for them.
Yeah,
100%.
All right, and
just
that being
just quickly on your thoughts of like, I just can't think of many times where you shouldn't be training. Even people who are like bedridden in a hospital, they're just, I know this is probably like a topic for another conversation. We've talked about it before, but like there's so much cool research into even doing like imaginary training to maintain muscle size and muscle strength. So that's a little fun fact for you, and maybe we'll dive into that another time when we have a bit more time. But like there's always a training practice you can do. It's just a matter of regressing and finding the level that you're at, and that might even be imagining training, but there's always something you can do.
there you go, guys. If you're in a hospital bed, you should still be doing your imaginary curls.
Yeah, absolutely. Absolutely. Shout out to Christy Lovejoy and at Beccino. I think that's, I don't know whether I got that right, but anyway, on YouTube. And guys, we'll see you all tomorrow. Have a fantastic day. And thank you, Phil, for joining us once again for Physio Wednesday.
Thank you for having me. Always love it.
See you guys.